English Daily, the podcast.
Your English journey starts now. Hey, English learners, welcome back to your podcast.
Yes, we're so happy to have you here today. I'm Jack, and I'm here with my wonderful co-host, Anna.
That's right. Hi, everyone. I'm Anna. Jack and I are so excited to spend this time with you.
Today's episode is all about English for nurses immigrating to Canada in 2026. This is such an important topic, Anna, isn't it?
Absolutely, Jack. There are so many talented nurses from around the world who are considering moving to Canada, and they have so many questions about the language requirements, the healthcare system, and how to adapt to working in a new country.
That's exactly right. And today, we're going to help answer those questions. We'll be covering vocabulary, real conversations, exam preparation, workplace communication, and so much more.
You know, Jack, I think this episode is going to be really helpful for anyone who's thinking about making this transition. There's a lot to learn, but we're going to make it fun and easy to understand.
That's the goal, Anna. We want to give you practical, real-world English that you'll actually use in your nursing career in Canada. Whether you're just starting to think about immigrating or you're already in the process, there's something here for you.
So, grab your notebook, get comfortable, and let's learn together. We're going to make this an amazing episode.
Let's dive right in. Anna, can you tell us a bit about the Canadian healthcare system? I know it's different from many other countries.
Absolutely, Jack. The Canadian healthcare system is publicly funded, which means the government pays for most medical services through taxes. Each province and territory manages its own healthcare plan, so there are some differences between provinces.
Oh, that's interesting. So what does that mean for nurses who are immigrating? Which should they know first?
Well, the first thing is that in Canada, we have a system called Medicare. It covers most essential medical services, but not everything. For example, prescription medications, dental care, and vision care are usually not covered unless you're on certain programs.
Wow, so nurses need to understand what's covered and what's not covered. That seems really important for patient education.
Exactly. And also, in Canada, we have something called the Canada Health Act. This ensures that all residents have access to medically necessary hospital and physician services without direct charges.
What about the different types of nurses? I know there are registered nurses, licensed practical nurses, and registered practical nurses. How does that work?
Great question, Jack. In Canada, we have registered nurses, RNs, licensed practical nurses, LPNs, and recently we also have nurse practitioners, NPs. Each has different responsibilities and scopes of practice. RNs typically have more responsibilities and can work independently in many situations.
I see. And the training and licensing process for internationally educated nurses can be quite challenging, right?
It definitely can be, Jack. Many nurses who come to Canada need to upgrade their credentials. They might need to take additional courses or write exams to practice here.
But you know what, Anna? The Canadian government and nursing organizations have been working hard to make the process smoother for internationally educated nurses. There are bridging programs in many provinces now.
That's really encouraging to hear, Jack. Now, what about the day-to-day vocabulary that nurses in Canada use? What differences might they encounter?
That's a great transition. In Canadian healthcare, you'll hear terms like charted for documenting patient information, assessment for evaluating patients, and care plan for the treatment plan. Also, we use a lot of interdisciplinary language because healthcare teams work together closely.
Can you give us some examples of that interdisciplinary work, Jack?
Sure, Anna. In Canada, nurses work with doctors, social workers, physiotherapists, occupational therapists, dietitians, and many other healthcare professionals. We have what's called rounds, where the team discusses patient care, and nurses are expected to contribute their observations and recommendations.
That sounds like a collaborative environment, Jack. I think that's really important for patient outcomes.
It absolutely is, Anna. And one more thing. In Canada, we have something called patient-centered care. This means that the patient's preferences, needs, and values guide all clinical decisions. Nurses really need to communicate well with patients and families.
Can you discuss documentation? I imagine that's a big part of nursing in Canada, Jack.
Oh yes, documentation is extremely important. We use electronic health records in most facilities now. Nurses document everything: medications given, vital signs, patient responses, interventions, and so on. It's legal documentation as well.
That sounds like it could be overwhelming for new nurses. How do they manage, Jack?
It does take time to get used to, Anna. Most hospitals have orientation programs and mentors for new nurses, and honestly, it gets easier with practice. The key is to be thorough and accurate.
So, to summarize what we've discussed about the Canadian healthcare system, it's publicly funded, there are different levels of nursing roles, documentation is crucial, and it's very team-based. Great stuff, Jack.
Anna, now let's dive into some essential nursing vocabulary that internationally educated nurses will need. What are the most important words and phrases?
That's a great topic, Jack. Let's start with some basic but essential terms. First, we have vital signs. This includes temperature, blood pressure, pulse, and respiration rate.
Yes, and blood pressure is often abbreviated as BP in Canada. Nurses measure and monitor these regularly, Anna.
What about medications, Jack? I imagine there's specific vocabulary there.
Absolutely, Anna. In Canada, we use terms like PRN for medications given as needed, STAT for immediate or emergency medications, and Medication Administration Record, or MAR, for documenting medications.
Oh, I see. And what about different routes of medication administration, Jack?
Good question. We have PO, by mouth, IV, intravenous, IM, intramuscular, SC or SQ, subcutaneous, and topical applications. Also, we often use the term GTT for drops.
That's quite a lot of abbreviations to remember, Jack. Do you think that's challenging for new nurses?
It can be at first, Anna, but you'll learn them quickly. Most healthcare facilities provide quick reference guides. And remember, when in doubt, always ask. No one expects you to know everything on your first day.
What about patient assessment terms, Jack? What should nurses know?
Important terms include subjective, what the patient tells you, and objective, what you measure or observe. Also, pain scale. We often use a number scale from 0 to 10 or FACES scale for patients who can't communicate verbally.
That's really practical, Jack. Now, what about some common Canadian expressions or phrases that nurses use?
That's a great point, Anna. In Canadian healthcare settings, you might hear phrases like doing rounds, checking on all patients, handoff or report when one nurse gives information to another at shift change, and code, an emergency situation.
What kind of codes, Jack? I've heard of code blue, but what others are there?
Good question. Code blue is for cardiac or respiratory arrest. Code pink is for infant or child abduction. Code white is for violent or aggressive behavior. Code red is for fire. And there are others depending on the facility, Anna.
Those are important to know, Jack. What about shift work? I imagine nursing involves shift work.
Definitely, Anna. In Canada, nurses typically work 12-hour shifts, either day shift, night shift, or a combination. We also have full-time, part-time, and casual positions, and there's seniority or bumping rights in unionized settings.
What about nursing specialties, Jack? What are some areas nurses can work in?
There are so many, Anna. We have emergency, intensive care, ICU, pediatrics, maternity, surgery, oncology, geriatrics, mental health, community health, and many more. Each has its own vocabulary and specialized terms.
It sounds like there's a lot of variety, Jack. What about continuing education? Is that important?
Extremely important, Anna. In Canada, nurses need to maintain their licenses through continuing education. There are conferences, workshops, and online courses. Many employers also support professional development.
This is all so valuable, Jack. Can you give us some examples of how these terms might be used in a real conversation?
Sure. Let me give you an example, Anna. A nurse might say, "I'm going to take your blood pressure," or "Do you have any questions about your medication?" and "I'll be your nurse for the next 12 hours" are very common.
Or another example, the patient reported pain at a level 7 on the scale. I administered PRN medication as ordered and will reassess in 30 minutes. Jack?
Those are perfect examples, Anna. What about communication with patients? Any important phrases there?
Yes, definitely, Jack. Phrases like, I'm going to take your blood pressure, do you have any questions about your medication, and I'll be your nurse for the next 12 hours are very common in daily practice.
These are all so practical, Anna. I think our listeners will find this really helpful. Anna, let's talk about the exam process. What exams do internationally educated nurses need to pass to practice in Canada?
Great question, Jack. The main exam is the NCLEX-RN, which stands for National Council Licensure Examination for Registered Nurses. It's a computer adaptive test that assesses your nursing knowledge and critical thinking skills.
I've heard of the NCLEX, Anna. Is it difficult?
It can be challenging, yes, Jack. The exam tests your ability to make safe and effective nursing judgments. It covers topics like patient care management, pharmacological therapies, physiological adaptations, and more.
What about other requirements, Anna? Are there other exams or requirements?
Yes, Jack. Internationally educated nurses also need to demonstrate English language proficiency. This usually means taking an English test like IELTS or CELPIP. The required scores vary by province.
Oh, that's important, Anna. What scores do they need?
For IELTS, most provinces require a minimum of 7.0 in each band, listening, reading, writing, speaking, for the general training test. For CELPIP, they typically require 7 or higher in each component, Jack.
Those are pretty high standards, Anna. How can nurses prepare for these exams?
There are many resources available, Jack. There are preparation courses specifically for the NCLEX, practice questions, and study groups. Also, many universities and colleges offer bridging programs for internationally educated nurses.
Can you tell us more about these bridging programs, Anna?
Absolutely, Jack. Bridging programs are designed to help internationally educated nurses meet Canadian standards. They typically include classroom education, clinical practice, and exam preparation. Programs exist in Ontario, British Columbia, Alberta, and other provinces.
How long do these programs take, Anna?
It varies, Jack. Some are a few months, others might be a year or more. It depends on the program and what gaps in knowledge or skills the nurse needs to address.
What are some of the biggest challenges that internationally educated nurses face when preparing for these exams, Anna?
I think the biggest challenges are adapting to the North American nursing approach, which might be different from their home country, getting used to the test format, and managing their time while possibly working or taking care of family, Jack.
But you know what, Anna? Many nurses have successfully made this transition. It takes dedication and hard work, but it's absolutely possible.
That's really encouraging, Jack. What about the exam format itself, Jack? Can you give us some examples of what to expect?
Sure, Anna. The NCLEX uses multiple choice questions, but also includes other formats like select all that apply, fill in the blank, and ordered response questions. The questions are often scenario-based, asking you to decide what to do in a particular situation.
That sounds like it tests practical thinking more than just memorization, Jack.
Exactly. It's about applying knowledge to real nursing situations. That's why clinical experience is so valuable, Anna.
Impressed, Jack. What about practical exams? Do nurses need to do a clinical exam too?
Some provinces might require a practical component or competency assessment, Anna. This is why the bridging programs are so helpful. They often include clinical placements in Canadian healthcare settings.
Jack, do you have any tips for staying motivated during the exam preparation process?
That's a great question, Anna. I'd say first, set realistic goals and create a study schedule. Second, connect with other nurses who are going through the same process. Having a support system helps a lot. Third, take care of your physical and mental health. And fourth, celebrate small victories.
Those are wonderful tips, Jack. Thank you for sharing all this information about the exam process.
Anna, let's shift to workplace communication. How do nurses typically communicate with each other and with other healthcare professionals in Canada?
That's a really important topic, Jack. In Canadian healthcare, we emphasize clear, professional, and respectful communication. There's actually a communication framework called SBAR that's widely used.
SBAR, Anna? What does that stand for?
SBAR stands for Situation, Background, Assessment, and Recommendation, Jack. It's a structured way of communicating that helps ensure all important information is conveyed clearly, especially in critical situations.
Can you give us an example of how SBAR would be used, Anna?
Sure. Let's say a nurse is calling a doctor about a patient. They might say, "Dr. Smith, this is Nurse Anna calling about patient John Doe in room 302, situation. He's experiencing shortness of breath and his oxygen saturation has dropped to 88%. Background. He was admitted yesterday with pneumonia and his condition had been stable. Assessment. I think he might be deteriorating and needs to be seen immediately. Recommendation. Could you come to assess him, please?"
That's a really clear and structured way of communicating, Anna. It makes sense that it would help prevent misunderstandings.
Absolutely, Jack. SBAR is used not just between nurses and doctors, but throughout the healthcare team. It promotes patient safety by ensuring everyone has the same information.
What about communication between nurses during shift changes, Anna? I've heard of handoff or handover reports.
Yes, that's really important, Jack. In Canada, we have structured handoff procedures. The off-going nurse gives a detailed report to the oncoming nurse, usually at the patient's bedside. This allows the incoming nurse to see the patient directly and ask questions.
What kind of information is typically included in a handoff report, Anna?
It includes the patient's name, diagnosis, current condition, medications, treatments, any changes in status, and any concerns or outstanding tasks. It's thorough to ensure continuity of care, Jack.
That sounds very organized, Anna. What about communication with patients and families? What should nurses be aware of?
Excellent question, Jack. In Canada, we emphasize patient-centered communication. This means listening to patients, explaining things in ways they can understand, respecting their preferences, and involving them in decision-making about their care.
What about cultural sensitivity, Anna? Canada is very diverse.
That's a great point, Jack. Canada is indeed multicultural, and healthcare providers need to be culturally aware. This means being respectful of different cultural practices, beliefs, and family dynamics. Many healthcare facilities have cultural liaison services or interpreters available.
That's really important, Anna. What about language barriers? How are those handled?
If a patient doesn't speak English well, hospitals will provide interpreters, either in person or through phone or video services, Jack. It's very important not to use family members as interpreters for important medical information, as that can lead to errors.
I can see why that's not recommended, Anna. What about communication with patients who have hearing or vision impairments?
Nurses need to adapt their communication accordingly, Jack. For hearing impairments, they might need to face the patient directly, speak clearly, or use written materials. For vision impairments, they should describe everything verbally and ensure information is available in audio format if needed.
What about patients who can't communicate verbally, Anna, like those on ventilators?
That's a good question, Jack. In those cases, nurses use alternative communication methods like picture boards, letter boards, or electronic communication devices. It's important to assess what works best for each patient.
This is all so valuable, Anna. What about communication in stressful or emergency situations? Any tips?
In emergencies, it's crucial to stay calm, speak clearly, and use the SBAR format, Jack. Also, always confirm that the person receiving the message has understood. And remember, it's okay to ask for clarification if something isn't clear.
One more thing, Anna. In Canadian healthcare, we encourage nurses to speak up if they have concerns about patient safety. There's a culture of speaking up to prevent errors.
That sounds like a positive safety culture, Jack.
It is, Anna. Patient safety is the top priority, and everyone on the healthcare team is encouraged to voice concerns.
Anna, let's talk about building a professional network. How can internationally educated nurses connect with others in Canada?
That's a really important topic, Jack. Building a professional network is crucial for career success and feeling connected in a new country. There are several ways to do this.
What are some of the best ways to meet other nurses and healthcare professionals? Anna?
One of the best ways is to join professional nursing associations, Jack. In Canada, there's the Canadian Nurses Association, CNA, as well as provincial associations like the Registered Nurses Association of Ontario, or RNAO, or the College of Registered Nurses of British Columbia, CRNBC.
What benefits do these associations offer, Anna?
They offer networking events, continuing education opportunities, mentorship programs, conferences, and publications, Jack. They're a great way to stay connected to the nursing community and access resources.
That sounds very valuable, Anna. What about meetups or informal networking?
There are also informal networking opportunities, Jack. Many cities have meetup groups for healthcare professionals. LinkedIn is very popular for professional networking in Canada as well, and many universities and colleges have alumni networks.
Can mentorship help? I imagine that could be really helpful for new nurses.
Absolutely, Jack. Many provinces have mentorship programs specifically for internationally educated nurses. These pair new nurses with experienced Canadian nurses who can provide guidance, support, and insights into the Canadian healthcare system.
How can nurses find these mentorship programs, Anna?
They can start by contacting their provincial nursing regulatory body or professional associations, Jack. Many bridging programs also include mentorship components. Also, some hospitals have their own mentorship initiatives.
That's great to know, Anna. What about volunteer opportunities? Could those help with networking?
Definitely, Jack. Volunteering is a great way to meet people and gain Canadian experience. There are many healthcare-related volunteer opportunities, like with the Canadian Red Cross, hospitals, or community health organizations.
What about attending conferences or workshops, Anna? Are those helpful?
Very helpful, Jack. There are nursing conferences throughout Canada every year. These are excellent for learning about the latest practices and meeting professionals from across the country. Many employers support attendance at conferences.
That's great, Anna. What about social media? Is that used for professional networking?
Yes, definitely, Jack. LinkedIn is the main professional social media platform. Many nurses also join Facebook groups or follow nursing organizations on Twitter. There's also a growing presence on platforms like Instagram for nursing education and advocacy.
One more thing, Anna. Don't underestimate the power of simply being friendly and approachable. Strike up conversations with colleagues, ask questions, and show genuine interest in others. Building relationships takes time, but it happens naturally when you're genuine.
That's a really good advice, Jack. What about maintaining connections with nurses from your home country while building new ones?
That's a great question, Anna. It's important to have a support system, and that can include connections from your home country. Many nurses find comfort in connecting with others who share similar experiences. There are often groups for nurses from specific countries or regions.
So it's about balancing both, connecting with those who understand your background while also building new relationships in Canada. Jack?
Exactly, Anna. Both are valuable. Your international connections can provide unique perspectives, while your Canadian connections will help you navigate your new environment. Anna, let's talk about the personal side of moving to Canada. What should nurses expect when they first arrive?
That's a really important topic, Jack. Moving to a new country is both exciting and challenging. Let's talk about some of the practical aspects first.
What are some of the first things nurses should do when they arrive in Canada, Anna?
They should apply for health coverage through their provincial health plan, get a social insurance number, SIN, open a bank account, and find housing, Jack. Also, they need to register with their provincial nursing regulatory body.
That sounds like a lot of paperwork, Anna. How long does it all take?
It can take some time, Jack, so patience is key. Health card processing might take a few weeks to a couple of months, depending on the province. The nursing license process can take several months as well.
What about finding housing, Anna? Is it difficult in Canada?
It depends on the city, Jack. In major cities like Toronto, Vancouver, or Montreal, housing can be expensive and competitive. Many newcomers start with temporary accommodations and then look for more permanent housing once they're settled.
I imagine cost of living is a big consideration, Anna. What should nurses nurses know about salaries and expenses?
Nursing salaries in Canada are competitive, Jack, but they vary by province and experience. Generally, new nurses can expect to earn somewhere between $30 to $40 per hour initially. However, in expensive cities like Toronto or Vancouver, the cost of living is quite high.
That's something to think about, Anna. What about transportation? Do nurses need a car?
Again, it depends on where you live, Jack. In major cities with good public transit, you might not need a car. But in suburban or rural areas, having a car is often necessary. Canada is a big country, and distances can be significant.
What about climate, Anna? I imagine that can be a big adjustment for people from warmer countries.
Definitely, Jack. Canadian winters can be very cold, especially in the central and eastern parts of the country. Snow and ice are common. Investing in warm clothing is essential. But the summers are beautiful, and there are so many outdoor activities to enjoy.
That sounds nice, Anna. What about making friends and feeling at home? Any tips?
Getting involved in community activities is a great way to meet people, Jack. Joining a gym, kicking a class, or volunteering are all good options. Also, many communities have cultural associations where newcomers can connect with others from similar backgrounds.
What about the healthcare workplace culture, Anna? Is it different from what nurses might be used to?
Yes, it can be, Jack. Canadian workplaces tend to value work-life balance. There are usually clear boundaries around working hours, breaks, and time off. Also, there's an emphasis on work safety and employee well-being.
Also, the hierarchy in healthcare teams might be less rigid than in some other countries, Anna. Nurses are encouraged to contribute ideas and question decisions when it comes to patient safety. It's a collaborative environment.
What about discrimination or challenges that newcomers might face, Jack?
Unfortunately, some newcomers do face challenges, Anna, including discrimination or having their credentials questioned. However, Canada is generally welcoming, and many organizations are working to support internationally educated nurses. Building a strong professional network and proving your skills can help overcome these challenges.
What about language and cultural adjustment beyond the workplace, Jack?
That's a great point, Anna. Everyday life in Canada might have some cultural differences. Things like customer service interactions, social norms, and communication styles can take time to get used to. But most people find that Canadians are generally friendly and patient.
This has been such a comprehensive discussion, Jack. Do you have any final words of encouragement for nurses considering moving to Canada?
Absolutely, Anna. Moving to Canada as a nurse is a big step, but it can be an incredibly rewarding experience. The Canadian healthcare system values nurses, and there are many opportunities for professional growth. Yes, there will be challenges along the way, but don't give up. Take it one step at a time. Build your support network and remember why you became a nurse in the first place, to help people. Canada needs dedicated nurses like you.
And don't forget to take care of yourself during the transition, Jack. It's okay to feel overwhelmed sometimes. Reach out for support when you need it, and celebrate every small victory along the way.
Thank you so much, Anna, for all this wonderful information. I'm sure our listeners will find it incredibly helpful.
Now, Jack, let's move to our vocabulary breakdown section, where we'll go over some important phrases.
Yes, let's do it, Anna. I'm excited to learn these new phrases.
First phrase, vital signs. This refers to the measurements of basic body functions, including temperature, pulse or heart rate, respiration rate, and blood pressure. Example, I need to check the patient's vital signs before the doctor arrives.
What about assessment, Anna? Can you explain that one?
Assessment is the process of evaluating a patient's condition through observation, measurement, and conversation. Example, the nurse conducted a thorough assessment of the patient's pain level.
Next one, care plan. This is a document that outlines the healthcare goals and interventions for a patient. Example, the care plan includes medication administration and physical therapy exercises, Anna.
Next, PRN. This is an abbreviation from the Latin pro re nata, meaning as needed, Jack. Example, the doctor ordered Tylenol PRN for pain management.
Another important one, STAT. This means immediately or right now, Anna. Example, the patient is having chest pain. We need to call the doctor STAT.
What about SBAR, Jack? We talked about that earlier.
SBAR stands for Situation, background, assessment, recommendation. A structured communication framework, Anna. Example, let's use SBAR when we call the physician about the patient.
Next, handoff or report. This is when one healthcare provider gives information to another during shift change. Jack, example, I'm giving you handoff on patient 305.
What about medication administration record, Anna?
That's often called MAR. It's the official record of all medications given to a patient, Jack. Example, don't forget to document the medication in the MAR.
Next important phrase, scope of practice, Anna. This defines what procedures and activities a healthcare professional is allowed to perform. Example, as an LPN, you need to know your scope of practice.
Another one, infection control. This refers to practices to prevent the spread of infections in healthcare settings, Jack. Example, proper hand hygiene is a key part of infection control.
What about patient-centered care, Anna?
Patient-centered care means providing care that respects and responds to individual patient preferences, needs, and values, Jack. Example, patient-centered care involves including the patient in all decision-making.
Next, interdisciplinary team. This is a group of healthcare professionals from different fields working together, Anna. Example, the interdisciplinary team meets every morning to discuss patient care.
Another one, continuity of care. This means ensuring consistent care across different providers and settings, Jack. Example, a good handoff report promotes continuity of care.
What about evidence-based practice, Anna?
Evidence-based practice means using the best available research evidence, clinical expertise, and patient values to guide healthcare decisions, Jack. Example, our hospital encourages evidence-based practice in all nursing interventions.
What does competency mean in nursing, Anna?
Competency refers to the skills, knowledge, and abilities needed to perform nursing duties safely and effectively, Jack. Example, the new nurse demonstrated competency in wound care.
Next, clinical placement. This is when nursing students or new nurses get hands-on experience in a healthcare setting, Anna. Example, my clinical placement in the ICU was challenging but rewarding.
Another important one, continuing education. This refers to ongoing learning to maintain and update nursing skills, Jack. Example, nurses are required to complete continuing education hours to renew their licenses.
What about nursing regulation, Anna?
Nursing regulation refers to the laws and standards that govern nursing practice to protect the public, Jack. Example, the provincial nursing regulatory body oversees nursing regulation in each province.
And finally, collaborative practice. This means healthcare providers working together with mutual respect and shared decision-making, Anna. Example, collaborative practice between nurses and physicians improves patient outcomes.
Now it's time for our reflection questions, Jack. Let's think about what we've learned today.
Yes, let's do it, Anna. These questions will help our listeners think about how they can apply what we've discussed.
Question 1. What are the key differences between the Canadian healthcare system and the healthcare system in your home country?
Question 2. Which nursing role in Canada, RN, LPN, or NP, are you most interested in? And what steps do you need to take to pursue that path?
Question 3. Which nursing vocabulary term from today's episode do you think will be most useful in your work, and why?
Question 4. How do you plan to prepare for the English language proficiency requirement for nursing in Canada?
Question 5. How can you build a professional network as a new nurse in Canada?
Question 6. How will you adapt to the communication styles used in Canadian healthcare, such as using SBAR?
Question 7. What aspects of Canadian culture and workplace norms do you think will be the biggest adjustment for you?
Question 8. What support systems will you need as you transition to working as a nurse in Canada?
Question 9. How can you balance maintaining connections with nurses from your home country while building new relationships in Canada?
Question 10. What are your next steps after listening to this episode? What specific actions will you take?
Take some time to think about these questions, Jack. Writing down your thoughts can really help clarify your goals and plan.
That's all for today, everyone. Thanks for joining us on English Daily, the podcast.
Yes, we hope you learned something valuable. Don't forget to subscribe and join us next time.
Remember, learning English is a journey, and we're here to support you every step of the way.
Bye for now, English learners.
See you next time. Take care.
Your learning journey doesn't stop here. Keep improving your English. Click the next video or explore more episodes we've picked just for you. See you in the next lesson.